Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and the Medicine-Rehab-Fitness Institute. My name is David Flench. I'm the President and CEO of the Medical Fitness Association. I'm co-hosting this episode with Jeff Young, the co-founder of the MRF Institute and an adjunct lecturer at the City University of New York, York College. Hey, Jeff.
Hey, everyone. I am excited to introduce a returning guest on the Medical Fitness Podcast, Dr. Jessica Matthews. Jessica has been a friend and colleague for more than 8 years, which is really cool, and has a very extensive background. So I'm just going to let her introduce herself because I wouldn't be able to do it any justice. So, Jessica, welcome back to our show. And I'd love for you to introduce yourself to our guests.
Well, first of all, thank you so much, Jeff. I mean, 8 years later, we're still friends, still wonderful colleagues, and I'm coming back on the show. So I must have done something right along the way.
That's exactly right.
I completely tease. It's honestly, it's such an honor anytime I have the opportunity to have a conversation with you and David. And I will just share for those who might be new to who I am. As you heard, I'm Dr. Jessica Matthews. I do wear a few different hats, so it is a lot to keep up with, Jeff, in fairness to you. It's
More
a
than a
lot.
few.
Only to say a few highlights that'll give some context to our great conversation I know is always in store for today's episode. I am a tenured professor at Loma Nazarene University, where I also serve as program director for the Masters of Science in Integrative Wellness program, which we'll get to dig into perhaps a little bit further. Also, outside of my appointment in academia, I do have a clinical and research appointment at UC San Diego Health, specifically within the Department of Family Medicine in our Centers for Integrative Health, where I've been able to really bring forward some clinical integrated health coaching services, both individual and group based coaching services, as well as engage in some lifestyle medicine focused research. So, again, I have a suspicion some of these things are going to come up in our conversation, but I will name one thing just by interest of background. You'll hear a little interdisciplinary kind of theme to our conversation and to my academic training. So I hold bachelor's and master's degrees in exercise science and physical education. So I am a trained educator and longtime exercise professional by background, and also have a doctoral degree in behavioral health with a focus on clinical integrated care. So that probably makes sense of why I'm back here today, perhaps engaging in this wonderful discussion I know is on an order.
Yep. Absolutely. I'm really looking forward to it. And I'm going to start off with the first question. I'm going to tap into first to the academia side. As a professor who teaches such a diverse group of health professionals, and I know that for a fact because you've had me present several times, and so I really get to see it firsthand. So, as a professor who teaches such a diverse group of health professionals from within one graduate program, what do you see as key knowledge and or skills that are needed to best support patients or clients in the health behavior change journey that are often missing from most traditional health professional education programs?
I had a suspicion we were going to get right into, kind of that interprofessional, interdisciplinary
Yes.
team, which, to be honest, and you do know this because you have spent time, which we're so appreciative of your time. You've continued to guest lecture in the program. The beauty of the program that I mentioned at Point Loma Nazarene is it really does bring together the true interdisciplinary healthcare team. When we talk about the practice of lifestyle medicine, it does require individuals from diverse backgrounds. So our students are registered dietitians, they're registered nurses, they're exercise physiologists, they're health and wellness coaches, they're going on to PA school, PT school, med school, you name it. It's so exciting. And in fact, it's always been the vision that if we're going to go out in the world and practice together, why shouldn't we be learning together in our academic studies? It sounds like very revolutionary, but just interestingly, from a traditional academic sense, we tend to learn in silos. And then I look to both you and David, what happens then when we go out and practice? We practice in silos. And so, if we really want to have truly an integrated team that's speaking the same language, understands how to provide most optimal patient care, we should be learning together. And so, this was the vision, to be honest. And Jeff, you've really been with us in the program since pretty much the start. I think it was the very
Yes.
first cohort. You were a
Yep.
guest lecturer. So, going back to 2016, the program was created. 2017, that fall, we launched the program. And right out of the gate, we had a full cohort, and it was that true representation. And so here's what I learned to answer the big question that you just posed, because there's a lot of lessons I've learned over the last 8 years and counting. I mean, our program continues to flourish, which is a real blessing. But here's what I've learned. The interesting thing is, as a foundational kind of missing piece, I would say, what was so interesting is all of the students, some of them come with a few years, 10 years, 30 years of professional experience working with real life human beings. That's a nice way I phrase it. Real life, diverse, complex human beings. And interestingly, one of the knowledge bases and skill sets that I saw was missing right from the get go was really, how do we effectively communicate with the very people we are called to serve in whatever capacity, whatever professional hat we're wearing? How do we engage with individuals and really support and empower them to make these lasting lifestyle changes, whether it be around physical activity, exercise, nutrition, the list of health behaviors goes on that are so essential for preventing chronic disease, for restoring health for people who have been, navigating the complexities of chronic disease. But yet, all of these healthcare professionals were really missing that background, both the scientific perspective, kind of the theories and the models of health behavior change, the theoretical underpinnings, if you will, but also the real skill set. When I say more, those communication skills of how do we partner with people in the change process. So that was one big thing I learned right from the get go. And I think it's something unique that our program's able to provide to our students.
Jessica, I don't know if you know this or not. And tell me if you do. But this is kind of what my dissertation's on. So basically, and so I'm definitely going to be tapping into you. I really should have had you on my dissertation committee. But in any case, I'm going to be tapping into you on this because it's exactly right. I don't have anywhere near the background you have on this, and yet that's really one of the main things that I could see is the communication, the skill set that's needed to speak with patients to help move them into whatever the behavior change that is needed. And obviously, uh, in my case, or from what I do, is the exercise component. But in any case, I want to say that, and I also just wanted to ask you because I'm curious the genesis, like the idea to that came. How did it come about? For you to create this program, did you have the support right away from the university, or was there any pushback? And hold on a second, there was one other question. The genesis support. Oh, and is this unique? In other words, are there any other programs in the United States like this?
Oh, such good question. I'm smiling ear to ear just because, goodness, it's fun to reflect. Once you see something come to
Yes.
fruition, I mean, continue to just refine and enhance it, and also vision for the future. Meaning, we're not done. Like, I could make a nice, easy job for myself and just kind of post up and say, "Hey, we've done a good thing." But I'm always thinking to where, kind of that Wayne Gretzky quote, like to shoot where the puck's going, like to go there to look ahead, not just where we
Yep.
are now. I will share excitingly now to answer the last question, that piece that you asked. There are more programs, but we're still few
Good.
and far between. So it's been wonderful. And I say, through leadership and involvement with the American College of Lifestyle Medicine, I've had an opportunity to kind of expand my network of wonderful colleagues and collaborators, see more programs come to fruition. That's both at the bachelor's level, master's level, doctoral level. It's been exciting to just see that there is interest. So I'm optimist to say I think we'll see more and more programs like ours, which is exactly what I want. I don't want our program at Point Loma to be this unique anomaly. This should be the way in which health professionals learn. Like, I feel that's
Yep.
a bold statement. And I feel so, you know this about me by now, Jeff. I feel so confident saying it because I see what the output of it is, meaning the integration out into the communities serving real life people. And it's been
Yep.
wonderful to see our students doing that across the country and even other parts of the world. So I think there'll be more to come, but it's still, a growing area of study. What I will say that's been, really cool, kind of just reflecting on the experience, where did this all come from? To be honest, it was from my own journey as a professional. I mean, I spent a lot of time working in the exercise professions, wore several different hats over the years. What brought me to sunny San Diego was actually I took a full time position with the American Council on Exercise back in 2006. It's been almost 20 years since I've started calling San Diego home. But I took, kind of this background and passion. And I know that was one of our early connection points, Jeff, of obviously we share this passion around the real power of exercise and physical activity. I mean, this is transformative for people. I've seen it in my own life, I've seen it with patients, clients, family members. And what I learned very early on, is to be really humble, meaning just being that classically trained educator, licensed educator, that wasn't enough. If I'm being truthful, it wasn't enough to just keep sharing information. Now, don't get me wrong, information is powerful. Knowledge is power, but I always say it's an overused phrase of mine. It's knowledge translated into action that is that secret sauce. And so it humbled me. It humbled me to say, already 2 degrees into understanding all the intricacies of the human body and health, and really, the lens of exercise as this core pillar for health restoration. All of that's still true. And what was I missing? And so that's what led me to get a doctoral degree in behavioral health. I mean, people thought I was crazy at that time. They're like, "Are you a psychologist now, Jessica? What are you doing?" And I was like, "I think this is the piece I need, like to really understand this aspect in my own work, but then to help bridge a gap in terms of the academic perspective, really giving the right knowledge, skill set, and complete training for health professionals across that healthcare continuum." So I will tell you this, Jeff. You asked a good question. Did I have support? I have to say, at Point Loma, I had amazing support. In fact, so much support that in 2016, I laugh because this is a fun story. Not many know. 2016, I was already in a tenure track full time faculty appointment at another institution. I left that role and became an adjunct faculty member at Point Loma. People also thought
Wow.
I was completely crazy. They're like, "Jessica, that is really moving backwards in your career." But they believed so strongly in the vision for the program, which was quite revolutionary. New graduate studies were new at the institution, but they really believed in the vision. And so I took a leap of faith, literally and
Wow.
metaphorically, stepped right
You
into it. Look where it is 8 years later.
you already had your PhD when you launched, because
I
you
did.
didn't, right?
I was right in that's the other part that made
Yeah.
it like people were like, "Wow, this is really bold of you." I was in the middle of a doctoral program and they
Yeah.
were just like, "This seems like a really poor timing." And I said,
Yeah, that's
"Timing
really
was
cool.
exactly right." And it was the right time and the right decision. And look at what we've been able to do through the program, which again, you've seen firsthand, spending
Yeah.
time with our students who are amazing.
Very, very cool.
Yeah, Jessica, this is really cool hearing all this history. I mean, today is the first day that you and I have met, so I'm learning all about you, and these kind of origin stories. Jeff and I talked about that sometimes. People's origin stories are really interesting a lot of times, and so thanks for sharing all that. That's I mean that's just great, and yeah, I mean ACE, they're a great strategic partner of ours, and do some great things, and switching from one place to another in the midst of all that. Wow. I mean, but sometimes those bold steps are what is needed for really making an impact, and it sounds like you are. I my background before working at MFA was working for hospitals in their wellness centers for over 20 years and leading those facilities. And I was hoping you might. I'm kind of coming off of our script of questions, but a lot of people listening probably think they know, and maybe they do actually know the full breadth of what health and wellness coaching involves. But I think as I talked, especially in healthcare, to a variety of disciplines, I think there maybe is a little bit of misconception around the concept, and I was hoping you might be able to share your thoughts on what that terminology, a health and wellness coach, what does that entail?
I'm smiling again here, dear, because what a $1 million question. And it keeps coming up because, to be honest, there isn't always a very clear description. If I'm being truthful, I think there's really growing interest in the role of a health and wellness coach on clinical teams. Again, I've been living that now for about the last 7 years. So I've seen the exciting growth, and I still see the opportunity to be clearer in our communication about really the valuable role that a health and wellness coach plays, and really what is health and wellness coaching. When we think about how do even other members of the care team communicate that to patients, right? The opportunity to align with a coach who can support them. So the way I would describe it, David, is I would say what a health and wellness coach really has the opportunity, good word choice on my part, the opportunity to do is to partner with individuals in the process of enacting and sustaining meaningful lifestyle changes, ones that actually move the trajectory of their health. So whether that's, helping to prevent those chronic diseases, or again, shared space, Jeff and I first connected was in the space of lifestyle medicine to say these actual health behaviors not just prevent chronic disease, but they even effectively treat and can put into remission or to reverse these chronic diseases. And that was things I never heard about early on in my academic journey and my professional journey. So that's a message of hope from my perspective. But that's what the coach does. It's that kind of rubber meets the road, having that partner alongside individuals in saying, knowledge is one thing, but how does that knowledge translate into action in their own unique life? And that's the part that individuals know a lot about themselves. Coaches know a lot about those health behavior changes and the process, the science by which people enact and sustain changes. When you bring those two sets of expertise together, I say now you're cooking.
Yeah. Well, thank you. And it's interesting as I think back to my time running medical fitness centers. We had our personal trainers, exercise specialists, and we employed those with degrees and accredited certifications. And so we kind of took the approach of hiring those with the highest level of training as we could. And at some point, I realized, uh, not only does our hospital seem to value this, and it's a term that's getting thrown around, and people are using it, but it's something that I think could assist in what we're doing. And so I was encouraging our staff to get that additional training, and I really feel like in the fitness industry. That is one of those, whether it's certification, just additional training, however it manifests itself, is something that can really make somebody stand out and make them more effective at what they're trying to do. Because trainers are working with people every day or every couple of days, things like that, and have that opportunity, like you said, an opportunity to really connect with somebody. But I feel like some of these skills really take it further. Do you kind of have a similar thought on that?
Absolutely. And that actually was a huge part of the work. And it's still work that I do to this day, but just again, opportunities I say now from my own professional experience, the opportunities within the fitness industry to actually bring forward this knowledge, this training, this education. That was a large part of my work with ACE. I spent 8 years working full time for the organization, spent another 6 or 7 years after that serving as a senior advisor, really focused on health behavior change and health coaching, and really how that could elevate, to your exact point, David, how that could elevate, again, the great knowledge and skill set and experiences of exercise professionals, all right? Again, across that continuum of exercise professionals, because they do have this really wonderful opportunity. Again, that word just keeps like organically coming up, but such an opportunity to have that connection, sometimes already having that established rapport, right? Depending on the other hats he or she might wear in terms of their day-to-day work, but to really come alongside. And you'll hear a lot of that word choice that I am intentionally using when we talk about coaching and the behavior change journey, because that partnership, it's not just a feel good word. It's actually an essential ingredient. It's essential to how actually behavior change unfolds. And again, I won't bore the doctoral student here who already knows all of this about look to the theories. You'll see this piece of relatedness, connection that keeps coming up over and over again in the behavioral sciences. So this is where I do think there's both the dedicated role of a trained qualified health and wellness coach, and also the opportunity for every member of the complete healthcare team in whatever settings we might be working in to also embrace a coach approach, because it's a both and that actually would really best support individuals in that process of change and in the process of actually improving their health and well-being.
Yeah. Well, you know, initially you talked a little bit about your involvement with the American College of Lifestyle Medicine, ACLM, and you were on the board for that, and found that you were on the board for the National Board for Health and Wellness Coaching. So, through some of those previous roles and leadership at the national level, what do you see as opportunities now to support this continued elevation and advancement of health and wellness coaches, particularly within healthcare?
It's an amazing question that you asked, because it's one again that will require a continued collaborative effort. So I think the best things in life always happen when great people, great organizations, great leaders, great, I say doers, the people out there actually doing the doing. That's one of my favorite phrases recently. Like the people, boots on the ground, working with real life human beings. We need all the perspectives to really continue to move the needle forward from this perspective of the role of a health and wellness coach in a clinical context, really seeing the health and wellness coach, a well qualified coach, as part of the healthcare team, not just in isolation at certain places, but as something that is just unified and consistent across the country and, dare I say, around the world. But I'll start with the US lens, at least, because there's complexities to the US healthcare system, as I think we all know in this conversation. But only to say to your question, it really has a multi pronged approach. It is the continued elevation of both the training and education standards. So now I've got my, academician hat on, only to say the way in which to ensure health and wellness coaches are well poised to be that collaborative member on a healthcare team is they do require requisite education and training. Now, again, it's wonderful since the time that I've been in this space, including when I started my clinical appointment at UC San Diego Health, there was no national board certification at that time. So imagine me, the great question you asked previously, David. People were like, well, what is a health and wellness coach? Who is this person? What background and training do they have? And I was like, well, I promise, like things are happening, but it still wasn't a defined credential yet. So I do think it's been an exciting movement to see, a unified national credential, to have that national board certification. And again, so I'm an optimist and a realist, and there will need to be continued ongoing, looking at those standards. That's why good practice and certification. I did spend some time in the credentialing world. Every 5 years, we should be performing a job task analysis or a rapid blueprinting process to look at what's the knowledge, skills, and abilities a person needs today to enter the field. I argue, I mean, that's changing rapidly, probably to be fair, even though 5 years is best practice industry wide for credentialing, in a rapidly evolving profession, you probably need that even more frequently. The piece I see to connect kind of the dots between my leadership from the National Board for Health and Wellness Coaching perspective and then the board for the American College of Lifestyle Medicine, I see a real opportunity, and I've been obviously living into this with the academic appointment I have at Point Loma, is to really further enhance the knowledge and skills around health behavior change. So that makes up a part of the requirements, for minimum standards to enter a field. I don't say that in a negative way. That's just credentialing language. These are minimum standards to enter a field, minimum competencies. But I see a real need to be on a clinical team. Coaches really will need a depth of understanding about those various health behaviors, the pillars of lifestyle medicine. Notice it's pillars, it's not one single one. We need knowledge about all of them. You don't have to be the expert because we have dietitians, we have exercise physiologists, we have people who specialize in certain pillars or certain behaviors, but we need that shared common knowledge. We also need a knowledge about things like health and chronic disease, meaning to speak the language as part of a clinical team. You do have to have an understanding about, clinical diagnoses, other health conditions, all of those things that, again, from a medical fitness perspective, I'm sure I'm speaking the language of both of you. This is just ensures we have the right frame by which to practice with real life dynamic human beings. So long and short, I see the need. We've started a great thing, and there's the opportunity to keep layering upon it to continue to enhance the knowledge and skills. And I also think really the opportunity to discern what are the models by which health and wellness coaches practice within a clinical setting, because that's the next $1 million question is how in the world is this financially supported? How do we make sure this makes sense? I mean, I do spend time in those conversations too, and that has to be a part of the conversation because financial wellness is a part of wellness, I always joke. So we have to talk the dollars and cents because that's how any great change really happens.
Jessica, I have a quick question for you, if I can even figure out how to word it, because this again, as you're talking, I'm thinking about my dissertation. And one of the things you hit upon is that there needs to be the merging of a bunch of different skill sets, right? And that makes it makes it challenging. Um, Now, when you're the program director of a unique, program like yours, and then you can start from the beginning and build all this up. But from my dissertation standpoint, I'm going to be now imagine that I'm going to, for example, a practice where I don't know the clinicians. Okay. But I want them to refer patients or, just to create a little anecdote here. Want them to refer patients and I don't know their skill set, but I know the skill sets they need to know. They need to know some things about exercise. They need to know about the coaching mindset, motivational interviewing, whatever the case may be. So my question to you is, um, how, like, for someone who's been in practice for 10, 15, 20 years, who doesn't have the luxury through this from the beginning. How do you approach something like that? Or is it even approachable to man, I hate to use this phrase, but it's the one that's popping in my head, teach an old dog new tricks type of thing, because that's kind of what it is, really. So if they're anyways, hopefully you get what I'm trying to say. And how would you approach something like that?
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
Yeah, absolutely. You can always teach an old dog new tricks. I only say it's totally approachable. And I only give this context again, since we're sharing stories about each other. I'm sharing a lot about my background, but those brave, bold moves continued, including, even though, yes, I do have the privilege of being kind of from, like you said, the ground up, meaning can kind of really provide the requisite training, education, and bridge that gap right over to how it actually works in practice because I do have those unique lenses and I sit in a few different seats. But a fun fact about me, my appointment at UC San Diego Health, I chose a doctoral program that actually would require a clinical rotation. Reason being, I didn't have that strong of a clinical background. I spent a little time in a hospital-based wellness center like fresh out of undergrad before I made the journey to California, but I was not a clinician, but formal sense by background. So I did a nice cold email, meaning I only give this context to answer your question, Jeff, which I promise I will get to, but to say there was I had no footing in there. I didn't know anyone. And I just started with kind of like, hi, here's who I am. And here's this whole concept of health and wellness coaching and what I think the value. So this is the part that I do think is big. What's the value? It's like any good, business proposition. What's the value to the end user? So instead of trying, beat the drum and try to, create a different, way in which to approach, which I've seen different approaches, some more positively received, some not so much. Starting with the value in mind, meaning when you go into this hypothetical, private practice, what's the pain points of that practice? Do you want to know what it is? I mean, they'll use different language choices, but I'll just say oftentimes you hear about frequent flyers, people with multiple chronic diseases that are really unmanaged, that are really unsustainable, both for the practice, for the human being that's navigating it. Those people are my family members. So I take it like highly personally. Like these are real life human beings that are doing things like losing limbs, going blind, going into renal failure because their chronic diseases are not being improved. In fact, they're rapidly worsening to the point of premature death. So I say that to say, what are the pain points? And then to understand, once you know also the pain points, and you can speak to that with evidence, of course, about, in this case, what is the value of whether it's an exercise professional, referring out to a well qualified exercise professional or health and wellness coach. There's great evidence we can point to. Again, synthesize that, give the punch points, really make that impactful. But if you understand the pain points, the next thing you do need to know, hopefully this will spark some maybe good questions that come up after this, have to understand the clinical workflow. I cannot tell you how many times people have said, I've reached out and they're not interested, but you don't understand how they practice. That's why, I mean, again, privilege on my part that I could insert myself into a clinical realm and be completely humbled. Like I didn't know anything about how it worked until you actually get kind of underneath the hood, so to speak. So I'd say learn the pain points, also get a sense of how does their workflow work because that will help you to position how would they make that referral, how are they going to get the communication and follow up, all those kind of normal natural important questions that do need to be answered.
You're so right. And this, here comes the disconnect again because we need to we don't understand each other's side of the fence. and it's so ridiculously important. I'm ridiculously fortunate that in this doctoral program I got to pilot my dissertation already. I got to do like a 3-week pilot, and that what you just hit on was really the main thing that popped out. Oh, I have all my ideas, but it needs to fit into their workflow, and if it doesn't fit into their workflow, they don't. There's no desire because they are already too busy with all the notes they need to take and all the stuff they need to do with insurance and stuff like that. So I had to make it this really simple process. So yeah, again, great answer. And we just need to, I wish we could always just be having in services with each other so we could always just teach each other our sides of the fence so we can better work with each other.
It's so important just to, and I'm so, I mean, again, that's the beauty of when you do have the opportunities like both of us have had with our doctoral training that you can, be immersed in it. So much value. And I only share this because I spent so many years in the exercise professions, in the fitness industry, where I always heard about, we need to bridge the gap. I keep using the air quotes because the bridge the gap. And I would be like, but we actually don't know about each other. We don't know what's on the other side of
Yes.
the fence, as you said so eloquently. And once we're humble enough, and that is an important thing
Yes.
too, humble enough to say, let me go learn what I don't know. Let me be
Yes.
open to thinking and not saying I have the solution. If you've never worked in a clinical setting, I will be this bold. It's very difficult for me to understand how somebody can say, I have it all figured out. I mean, you can have ideas, but then what you want to do, just like we do in coaching, we want to hear the expertise of the person, or in this case, the expertise of the people who are practicing in a clinical setting where, we see the opportunity, again, great word, to start to create alignment, referrals, but they also want to have a feedback loop. That was another thing that I would say came up loud and clear is that when physicians who deeply care about their patients are going to refer them, whether, that's part of the system or to someone outside the system, when they refer to another professional, you know what they want to know? How did that go? Like, how is that going? What was talked about? What's the next steps? So there needs to be a feedback loop. And that gets into just, logistics and structure. Sounds like what you've been living into of how do you create that workflow and the partnership within the clinical team. So it starts there so you can partner with patients effectively.
Absolutely. Love it.
Yeah, I feel like this is some gold right here, right? That's being shared. I mean, that's fantastic. I completely agree with those sentiments. Um, you know, I did my research on you beforehand and went to your LinkedIn page, and you've talked a little bit about some personal health experiences. I read a little bit some story about your mother, I think it was, and so I just want to kind of hear a little bit more these personal experiences and how they have helped shape your professional trajectory and really how they influence your approach to all of this and what lessons you've taken.
I so appreciate you asking this question, David, because it means everything to me. It's the whole basis for my entire professional work. And I often say my mom gets a lot of credit because my mom is often my case study in many places, whether it's a LinkedIn post, a lecture I'm giving, something I'm talking about in clinic. She really is someone, I mean, just I have the deepest love, just always have wanted to see her thrive in her life. Of course, she's my mother. So I want that for her and I want that for all people. But it often where you get some of the greatest inspiration, I've just learned in my own journey, maybe some listeners, this will resonate with them. They come from the hardest places, meaning I did grow up in that family I alluded to, where I said, those complex patients, the frequent flyers, quote unquote, those are my family members, real life human beings. Like they're just not a number, they're not a non compliant patient, they're people really trying the best that they can sometimes with the limited knowledge, skills, resources. I mean, that's a whole nother frame to what we teach in the program too. There's many factors that influence health. And the message of hope is there's so much within our control. That's not to downplay, really all of the other myriad of factors, but to say there is a message of hope in helping people understand what they can do in their lives to support their health, their well being, and their thriving. But my family were the people who had uncontrolled type 2 diabetes, heart disease, obesity. And then I saw early on what the ramifications of those chronic diseases were if they were not well managed, treated. Never knew they could be things like reversed or put into remission. Like that was beyond my thinking and understanding. But my mom, she's a wonderful case study to say, she suffered so many of the effects of those chronic diseases over decades. And she's still here today. At one point, she was given literally a 1% chance to live. It was after a second heart attack, triple bypass surgery. She was in a medically induced coma for a month after that. They said the likelihood she would live literally 1%. I mean, that's what they told our family. We held down to 1%. My mom is the 1%. Someone has to defy the odds, I say. So that's my mom. But you know what's been so powerful is the lifestyle changes she has made in the time since what was such dire straits. I mean, we didn't think she would be here. We thought she would be long gone by now. Here she is, thriving in life, going from having A1Cs of 13. I mean, that was like common for,
Wow.
I can't even tell you how long. Her
Wow.
completely normal A1C. She's been below 5.7 for, I don't know, at least like 5 or 6 years now. It's incredible. And that's the power of lifestyle medicine. It's why I got so involved with the American College of Lifestyle Medicine to recognize I wasn't the only one who was doing these things, teaching these things, practicing these things. But that's just one point in the journey. I will share from a behavioral health perspective, not only from my own mother, but also the challenges I faced with my sister, who really struggled with substance use issues stemming from chronic pain. And the prescribed course of treatment was opioids at the time. And unfortunately, my sister is no longer here physically with us. That was something that, really did shift so much for me: perspective on life, perspective on what just whole person health care looks like. Again, these are things that just inform my day to day work. And I think it's what keeps me this enthusiastic so many decades later. And I won't lose this spark because, again, I think about the people in my life, and then by proxy, the people I've been able to impact, through my teaching, through my clinical practice, through research. And I don't take that lightly. I know it's a real gift and a real privilege to be able to do this work.
You know how passionate I am about this as well with my wife, and her multiple sclerosis. And one thing I just am very compelled to interject, piggybacking off something you said, the importance of lifestyle medicine and the fact that so many conditions can be uh, adequately managed, controlled, maybe even reversed, maybe even put into remission, etc. And I just feel like there needs to be more people who realize that. And one of the things that I'm passionate about and that bothers me, frustrates me a little bit, is that the phrase lifestyle medicine doesn't work. I don't know if you've seen that or not, or heard that through in social media, but I definitely see it in the circles that I'm in. And it's very frustrating to me because my response, when I do respond as professionally as I can, is not pretty much nothing works if it's underdosed. But if you dose it properly, and then along with that, you provide the support that the person needs as well, and then social determinants of health and the resources and all that stuff. So it can get complex, but the point I'm trying to make is that lifestyle medicine does work when it's dosed properly. And so I just felt compelled to interject that because I know you live it and have seen it a zillion times, myself as well. So I just wanted to throw that in there.
And I so appreciate you sharing that, Jeff, because there is a difference. That's where I say, again, I'm going back to my early, it's always helpful when you can talk from lived experience. Like my early
Yes.
days as a professional in my formal academic training, it was all focused on prevention, which, please don't get me wrong. The beautiful thing is, these lifestyle behaviors we're talking about, exercise obviously being such a key one, other pillars of lifestyle medicine, they're vital and they can, in fact, effectively prevent chronic diseases. This is great. But then I'd say, what about the family like me that you already have them? There was never a message of hope or direction to say, with evidence based, therapeutic, appropriately dosed, because that is the main piece. And that's the
That's right.
difference. Kind of goes back to David, your question you were asking too, of even the role of like a health and wellness coach in a clinical context. It does require an additional level of knowledge and skill about things like what are those, you're not the one necessarily making the prescription per se, but you're helping to partner with the person in enacting that lifestyle prescription and navigating what does that look like, because there's not a one size fits all or a linear trajectory to what behavior change looks like. But you have to understand that key piece that you brought up, Jeff. So I'm so glad you mentioned it, because it is more than just saying, eat better, exercise. I mean, my mom was told that for decades. That didn't move the needle at all. In fact, her health just worsened, worsened, worsened. It wasn't that it was bad advice, it wasn't appropriately tailored to her and her needs,
Yep.
her conditions, and her current state of health. So it's like a nice thing to say, but that's actually not going to be the kind of real medicine we're talking about. That'd be like saying if I take a medicine, pick any dose and it's fine. I mean, that's not how a pharmaceutical or pharmacological intervention is delivered. It's like, why would we think lifestyle would be the same for chronic diseases, especially people who are facing multiple chronic diseases? That's where you do need, again, I am biased because I'm board certified in lifestyle medicine. This is something our program at Point Loma is a full academic pathway, meaning our students are eligible to immediately sit for lifestyle medicine board certification. The right training matters because the right therapeutic dose of lifestyle interventions, they matter too.
Exactly right. And one last thing related is another thing that bothers me is when you look at statistical averages. Oh, only 10%, et cetera. But then it isn't dosed to the individual. The research studies, they're just using a single protocol and applying it to however many participants are in the study, and then looking at the statistical averages. And I just think that that's a flaw in the way we're going about things. But anyways, I appreciate your response and feedback. So look, I'm looking at the clock and I see we probably only have about maybe 10 more minutes. But I want to switch gears here for a second and ask you a question or two about UC San Diego Health. So the first one is that you've led the development of health coaching services there within their clinical settings. What challenges did you encounter in integrating health coaching into traditional healthcare models, and how were they addressed?
Again, big questions you both are coming with today. I really like these questions. They're very fun because it's fun to reflect. And I love sharing openly because this is how we learn from each other. We get
Yep.
better together. We can make a real impact on a broader scale. So beyond just UC San Diego Health, but I can share again from lived experience, really, spearheading that work. The main thing it started with, kind of like David asked early on, explaining who is the health and wellness coach, the kind of qualified coach. I do use that because it is a non-licensed profession, akin to the exercise professions. That doesn't mean that they don't play important roles on the team, but there's just some questions about. So tell me, who is a health and wellness coach? What is the role of coaching? What would that look like in practice? So these were some of the early things that had to be shared. And that was hard to do when there was, again, not national, there wasn't a national standard yet. It was a little premature. As those things have started to kind of catch up, that's helped to kind of just reinforce, putting health coaches on our clinical teams, having coaching be a service line that is integrated for us across primary care, and also establishing a really great collaboration with population health services, which again, talk about impact. This is how you really scale, which has been amazing. So it took a lot of, I honestly, just getting to know one another. I'd say, having conversations, finding those champions and collaborators when there were questions that were raised, which were valid questions. I'm being honest, if we can be truthful amongst friends. I mean, there were some real concerns people had of, are these people really qualified? How do we know they're going to be a good fit? So, ensuring we were bringing the right kind of coach onto our team and, being able to obviously, post jobs, be able to hire coaches. We have another position we're hiring for as our team grows. It's so cool to see how far we've come. But I will share, some of the challenges we face. I'll be honest, it's still one that I face today, which is how do we pay for this? It is an traditional fee for service model. It is challenging when, generally speaking, health and wellness coaching services are not widely reimbursed. Again, our team, this connects to some of our research related work we've been doing. But from a national perspective, our team did lead the data collection for the Category 3 CPT code project for health and wellness coaching services. So the fact that there are Category 3 codes, which are used for data collection to show service utilization, we've played a leading role in that work that's been happening nationally with some great collaborators. But at this moment, it is not a widely reimbursed service. So I tease, I've had to be kind of MacGyver-like in how I financially stand up these services. So we're employing coaches at a rate and a value of the value they bring to our team and to our patients, but also making sure that's going to be sustainable long term. So I'd love to say I have all the answers. I've got a few insights over the years, but there's still more work to do in the field and work that I'm excited to continue to be a part of.
The evolution from CPT-3 to reimbursable CPT-1, like, you it's been has that happened? Like, where's that transition right now?
Yeah, so it did. There was a movement and an application for Category 1 codes that happened. That was almost 2 years ago now. The
Okay.
National Board for Health and Wellness Coaching and a few other collaborators supported. That's where our work doing the data collection as the
Yep.
research team fed into some broader work that had been happening for years. It did not get approved at that time. If I was being honest, I think that was a bit too premature. I only say again, lessons learned when you're in the trenches. The CPT codes, the Cat 3, they only got approved January 1 of 2020. And you may both remember what then unfolded a couple months later in 2020, a
Yeah.
global pandemic, which I only
Yeah.
say we enacted the codes, but having a health system prioritize a non-reimbursed code amidst navigating all the complexities of a pandemic, it wasn't priority for many places. Meaning, at that time that we went for the Category 1 application, there wasn't enough data, I believe, at that time, what our research team saw of people using the Category 3 codes. Many people were delivering coaching services, but a lot of different ways it looked. It wasn't uniform. And I will be frank, I do think also having objective, unbiased voices that really are leading that charge, so that there isn't any vested interest or competing priorities, but that it's
Right.
really coming together with a collaborative, unified voice. I do think that's going to be key in any great movement forward with reimbursement.
Yeah.
Yeah. You brought up the fee for service, and that's a volume-based approach that, historically has been the major system within healthcare. And, we're starting to see the value based care approach. And I would say, a lot of hospitals are starting to try to transition or use some hybrid of the two. And they can't completely move away from this fee for service where it's important to have those, but under the emerging world where there's bundled payments, and health systems are being incentivized to keep costs down, to keep the quality of care moving up, and having some of those accountability measures and those sorts of things. I think there's other paths to getting this type of service integrated even more. And I think that's part of the key. And so I'm hopeful that some of this, CMS wants to have 100% of their payment going through value-based models by 2030. And so that's just around the corner. And so I have some hope for this. I mean, some of that is tempered by seeing how tough it is to move a system. And healthcare is just one of those systems that it's more than turning the Titanic or whatever. Not Titanic, that's a bad word to associate. But anyways, how do you see that? Is that another way that this can get more integrated within the healthcare world?
Absolutely. And I say, David, spoken like somebody. I love when I have conversations with people who I call the doing of the doings. Like you're actually someone who is speaking about something that I'm so passionate about. And again, I've been living. That's where a wonderful collaborative approach. We have a multi-pronged approach of what it looks like. I say behind the curtain in terms of how our clinical services for health and wellness coaching are structured and how we actually deliver services to patients to meet diverse patients that have diverse needs. But that part about what it could look like, the different models, that absolutely has to be a part of the conversation. It's not just Category 1, approval of these 3 CPT codes for coaching. It's more than that. And I say the collaborative partnership we forge between family medicine and population health as an accountable care organization, we've been able to say, look at the outcomes, because that's the other key piece is we've been able to say, when patients receive coaching, what kind of outcomes are we seeing? Primarily, our system is interested in what probably many systems are interested in, seeing reductions in blood pressure, reductions in A1C. Great news, coaching, some of the strongest evidence that we have presently is around reductions in A1C. So, coaching as it pertains to people with type 2 diabetes. Promising area that's continually growing in the research is around blood pressure reductions. And I'll share that's been work we've been doing. We'll soon have a paper in the future publishing, I don't know, almost 4 years worth of data of seeing what kind of positive improvements we've seen both with blood pressure primarily and then also A1C. So I think that absolutely what you said, nail on the head. It's going to be a multi-pronged and multifaceted approach. And then each system can kind of see also what works for them. But it's nice to think beyond solely the fee for service structure.
Well, geez,
Jessica.
I think we're running out of time. We didn't get to
Yeah.
ask all our questions. You've just, given us such great responses, and this has been an awesome conversation, Jeff. I'm sure you'd say the same thing. But
That's why she's a return guest.
yeah, yeah, yeah. So Thank you so much for sharing your knowledge and expertise in this area. And we like to end a lot of times with having you tell our listeners how they can connect with you, whether it be social media or however you prefer people to connect.
I love this. I love that the connection. We talk about the power of connection. That is one of the pillars, social connection of lifestyle medicine. But the connection extends beyond this great conversation, which honestly, it's been a joy and a privilege and a pleasure. Connection points. Of course, I am out there in the world. I joke with my college students, but I'm not that cool and trendy. But of course, I'm on social media at Dr. Jess Matthews, Instagram, Facebook, LinkedIn. Would love to connect wherever people love to connect nowadays. I will share one other thing because in that commitment I mentioned earlier to continuing to evolve the education, the training, and foster real community among coaches and other collaborators passionate about health behavior change, would love to share a place people can come together. It's in San Diego, but also via virtual live stream. We have an annual conference, which is the Health and Wellbeing Coaching Conference, a professional conference in a field that had no professional conference. So my husband and I said, let's make one. And you know what, Jeff, you'll love this. Last year, our keynote speaker was the Dr. Bill Miller of motivational interviewing fame. So
Yeah,
these are the
wow.
kind of caliber of speakers we have. The community's been amazing. We see this as being really an opportunity to come together, create change together. This is how you really lead, by bringing the right people in the same room, whether that's physically or virtually. But we can really do great things when we do it together.
Well, David knows about that, being president and CEO of the MFA. He knows all about the importance of conferences, without a doubt.
Absolutely. Yeah, we have got a bunch of good ones coming up, and now that I know about your conference, I'll have to see how I can potentially get involved with that. That sounds amazing. But thank you so much for being on our podcast. It's been great connecting with you. I think two words that have resonated throughout this episode were opportunity and hope. Those are the two that I'm thinking that's what you've really talked a lot about, and that's just fantastic. So, Jeff, you want to wrap us up?
All I say is thank you so much. I'm going to be in touch because I need your help actually with the dissertation part and other things I have going on. So I'll be in touch in the near future. Thanks so much for being a returning guest and for sharing your wisdom.
So I thank you both so much again. Great conversation as always.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.